20-year-old Rebecca Nyiragongo fled clashes in June between the Congolese army and the rebels around Nyiragongo Territory with a husband and one-year-old son. They found shelter at this school-turned camp for the displaced in Nyiragongo Territory, along with hundreds of others.
We arrived here on foot because we had no transportation, but had no food. I went 5 days without cooking, and my child became weak. I took him to the health center, but nothing worked.
Her son was malnourished, got sick, and on July 17, he died. In the town of Kanyaruchinya, those newly displaced keep arriving, stretching the few resources available.
Since we have been here, we have had no assistance. I have already buried 4 people because of the lack of water, food, and shelter. We are suffering a lot.
The UN Refugee Agency, or UNHCR, says clashes since March between the Congolese National Army and the rebel March 23 movements have forced more than 160,000 people to flee their homes. The UNHCR says it has received less than 1/5 of a $225 million budget request for the DRC that was based on needs before the fighting broke out. Medical aid is also stretched in Kanyaruchinya as the town has only one mobile hospital.
The
hospital was installed in 2021 under the leadership of the president, but there has been no improvement in terms of equipment and logistics. The government has been giving almost nothing lately, and the crisis has caused problems with health care.
Meanwhile, protests this week against the UN peacekeeping mission in eastern Congo turned violent and left at least 15 people dead. The demonstrators accused the peacekeeping force of failing to stabilize the region and keep them safe. Whether or not one blames the peacekeepers for the situation, it is clear that safety in the towns near Goma is a scarce commodity. Ruth Omar, Esther for VOA News, Nyiragongo Territory, Democratic Republic of Congo.